Good morning, everyone, and welcome to the Candiota County Board of Commissioners meeting for Tuesday, February 4th, 2025. If you're able, please stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, our first item of business is the approval of the agenda, and can we get a motion to approve the agenda today?
I'll make a motion, Mr. Chair, to approve the agenda.
Commissioner Dwayne Anderson moves. Is there a second?
I'll second it.
Commissioner Dale Anderson seconds. Thank you. Questions, discussion? Hearing none, all those in favor say aye.
Aye.
All opposed? Motion carries. The next item then is the consent agenda. These are the standard items that we typically see. They include the approval of the January 21, 2025 County Board legal minutes, approval of the auditor's warrants and claims, and approval of the January 21st, 2025 closed session minutes. Are there any consent agenda items any commissioner wishes to pull? Hearing none, then I would accept a motion to approve the consent agenda.
Mr. Chair, I so move.
Commissioner Berg moves. Is there a second?
I'll second
Commissioner Emdek seconds. Thank you. Discussion? All those in favor say aye.
Aye.
All opposed? Motion carries. Thank you. We are at our first item then of general business discussion, United Community Action Partnership update, and I'd like to invite Heather Jeseritz to the podium. And of course, as always, Heather, just introduce yourself and who you're with.
Absolutely. Heather Jeseritz, the Director of Community Services at United Community Action Partnership. Good morning. Chillier than I thought it was going to be this morning. I didn't even bring a coat, so there's good Minnesota planning. But anyways, I am here to talk about the family-based and PSAP services. But I'm going to start with our emergency shelter unit briefly, because I heard there was some interest from the board about getting a little update about what is happening over on Wilmer Avenue and how exciting, right? So I'm going to give just a little bit of nibbles on that, and then you guys can ask me questions, but we are going to come back and do kind of a full picture utilization and program update on that probably in May, right around there, unless you want something sooner. But so about a year ago, we received funding for emergency shelter. As you know, homelessness is not decreasing. We know that housing shortages, housing affordability is on the rise, which means our homelessness numbers are going up as well. And so we really, as a community action agency, look at mission-focused services, which ties directly into housing and how do we stabilize families here in Candiota County. So about a year ago, we wrote a grant thinking not a chance. Are we going to get it? Because we asked for a lot of money, but we did, and it was just amazing. And out of that, we did a lot of research. We worked with Marcus Construction and think, what do we do? Do we stick build? Do we do modulars? At the end of the day, we came up with modulars are great. We've been working with North Star in Redwood Falls to build these basically like Lego blocks and pods that get stacked and stacked. If you've been over by Cashwise or Redwood Middle School, you've seen them. I mean, like one day it was dirt and the next day there's buildings, right? So that's just been a wonderful process. We've been meeting weekly. The city of Wilmer has been fantastic. Again, Marcus Construction and others here have just been amazing to work with. So right now we have an 8-plex and a 4-plex over on our lot. And we do have room to expand if funding were ever to allow that. And so we will, at the end of it all, have 11 units that we can use for families in transition, families who are, maybe just needing a little bit of help and support to get from their homeless status to stably housed. And then we'll have one of those we're turning into an office. So we'll have staff right on site to provide case management. Whatever that looks like will depend on the needs of the families or individuals that are staying there. But they'll work on things like employment and just any other barriers, transportation, education, whatever that might look like. So, and then we'll assist in hoping to get them into affordable, safe, stable housing after that. We currently are working on buttoning everything up. We meaning not me, but I do tour it sometimes, so I am contributing. Electrical and plumbing and all that has to get connected, all of the units. And we're hoping for maybe an occupancy of at least a few of the units by late spring. We're shooting for. You know how that works with construction. But we're gonna go slow. We wanna make sure we're doing it right. This is a brand new model for us within our area and many around the state. It's kind of a new concept. And so we wanna do it right. We wanna get all the pieces together. So we'll probably start by filling a few of the units and then progress and add on from there. Questions?
Any questions further?
Yeah, so I'm on the UCAP board, and I've been watching this or seeing how this is going, and I would just say this, if I ever wanted to build, I'd hire them to do it for me, because they're doing a great job with it, and it's been fun to watch. I stopped by there one day, took a couple photos, and I really wanted to pick up a hammer and start putting in nails there. It looks kind of fun, so, but it really was it's really kind of a neat project going on there, and it's kind of impressive to watch, so.
Yeah, thank
Yeah.
you.
I mean, I know there's a need, but do you have like a waiting list, or how are you guys going about filling those units, or is it a first come, first serve, or how is that working?
Good question. So currently, when we have families who are literally homeless, and again, we define homelessness, I should just say this, like sometimes it's they're on the street homeless or living in their car. Also, it could be doubled up, in conditions where they shouldn't be there because maybe the person who holds the lease is gonna face eviction if they have too many people there, things like that, right? Or facing eviction from their current dwelling and do not have a place identified to go within 7 days. So we look at homelessness as kind of a broad spectrum of need. So there definitely is a need. Currently, when we have people that are literally homeless, street homeless, living in their cars, places not meant for habitation, we use shelter vouchers, motel vouchers, and things like that. So, and they're always full. So yes, we have a wait list currently whenever we're looking at people needing housing needs, whether it's shelter, first one's rent, damage deposit, stabilization, doesn't matter, there's a wait list. We do prioritize certain populations, so disabled, people with children, seniors. So we do prioritize based on the population and the needs. But for this specific project, we would utilize that same waitlist structure. So we don't necessarily have a waitlist for those specific units because, of course, we don't have an open date. And if somebody's in crisis, they really want to know like when, how, things like that. But we do keep a waitlist. I'd love to not have one. Whether that's because we have enough shelter or because the need goes away. Preferably, I want to retire someday, and I would love to eliminate poverty to be the reason I'm out of a job. So we'll keep working towards that.
Mr. Chair, so I have another comment. One thing I've learned about this situation is people don't just get to sit and eat popcorn and watch TV all day once they're in those places. They get maybe a few days to kind of get their feet under them, and then they got to start meeting certain criteria. Am I correct on that?
Yeah, no, that's absolutely correct. So we give a couple days, right? When you're living in crisis, I don't know where I'm sleeping tonight. I don't know how I'm feeding my kids tonight. I mean, to be a parent, not know where my kids are going to lay their head at night. Is it safe? Is it warm? Are they fed? It just crushes a soul, right? And so, right, we give them those couple days to say, I'm safe, I'm here. They can kind of relax and get a shower, a hot meal, whatever that might look like for them. But then it's kind of like, now let's put some action behind this. What are the goals? What are the barriers that you're seeing? How can we help support you? Is it landlord connections? We also see a lot of barriers just with language. Right? So how do I find housing? How do I access different things if I have a limited English skill or literacy concerns? It's not just about Spanish, Korean, Somali. Sometimes it's a literacy concern in general. So we got to look at that a little bit bigger. So our staff can come in and provide whatever supports are needed based on the goals identified by the family and the barriers. Yeah. But it definitely is an action plan for sure.
Roger.
Thank you. I don't know if it's still the case, but it wasn't very long ago that one of the biggest barriers for people to hold jobs, have jobs and hold them was reliable transportation. Is that still an issue, or has that pretty much been resolved with action that you've taken?
I'm not going to say that it's the number one reason why, because I don't have that data in front of me, but it definitely is a a factor in retainability or obtaining of employment. And so, yes, we're making strides. We've been here and talked about our helping people get their car donation program. We now have some car repair dollars through deed. And so we are definitely making a dent in that process of transportation. We'll also help with bus tokens and bus passes and things like that. But it is still a barrier. We have a lot of families that can only afford one vehicle, but very few families can afford to only have one worker. Right? We also have a lot of shift work here. And so we have parents having to share vehicles, and sometimes that works and sometimes it doesn't. I will tell you, not to go on a tangent, the biggest issue right now as far as job retention and obtaining employment is the lack of childcare.
Yeah.
A whole nother conversation we could have for days, right? Childcare and the lack thereof is a huge barrier to the employment issue. Yeah.
One more thing. Steve.
I'm gonna give.
Okay, all right.
First.
Okay.
Thank you, Mr. Chair. Just a quick question. I know the need's out there. There's a big need out there. How do you coordinate with Family Promise and how are you different if you are?
Absolutely. So we coordinate with Family Promise. We coordinate and partner with Salvation Army, who also does vouchers. We, the domestic violence, Safe Avenues. And when we look at the prioritization and we assess families, we really are looking at, yes, of course, we have to look at where there is availability, right? First and foremost, who has an option? And then if we have multiple options, what's the best fit? What are their needs? Are they fleeing domestic violence? We want to connect them with the domestic violence experts, which is not us. That would be Safe Avenues. We have some where if it's a single male, Family Promise isn't necessarily the fit. That's not necessarily aligning with all of their criteria, but we can. So then it's us. And so we work really well together and say, not just meeting the need, but what's the best possible solution of what we have available.
Thank you.
Yeah.
Good.
Go ahead.
Sorry, when you talked about daycare, could you mention a little bit about Bright Lights and good news that we had about, getting it?
Yeah, gosh, Dwayne, I'll talk for days up here, y'all. I just told her I have an
It'll-
hour and a half.
it'll help
to
me
read
with
this
my
morning,
report
so
outs and I don't
we
have to
can talk
report on
forever. Yeah, no, that's great. So with childcare shortage, of course, we're looking at slots across the board, right? We know we're hundreds of slots short within Candido County alone. And at UCAP, we have our Head Start program, which we provide early childhood services from birth, actually expectant mothers, all the way up to kindergarten ready age 5. And so for the past, I want to say, don't quote me, but you're going to quote, but 7-8 years or so, because I can't really say that here, can I? 7-8 years or so, we've been in a wonderful partnership with Candido County Lights and Power, and we have 125 kiddos that we support every single day out at Bright Lights. And we've spent the last 4+ years writing grants to try to be able to purchase that facility, and we finally got the money. So now we get to purchase that building, and we will have a permanent forever home for those 125 kiddos and their families who also receive great services. And of course, by owning it, it's an asset. And so we will be able to save rental dollars that we were paying on rent and put that back into programming. So it's really, really exciting. Is that good, Dwayne?
That's very good.
Okay.
Thank you.
All right.
Everybody asked all the questions I would have asked. So you're up here to talk to us today about just a general partnership update, and then I know that you have an item after this. So go
Absolutely.
ahead.
So the real reason I'm here, no, just kidding, is Family Base and Peace Up, which Peace Up is our parent support outreach program. So each year we come and we give a program and a partnership update of not just what UCAP's doing, but some of the needs that we're seeing, some of the impact, and then again, just why the partnership has been so pivotal and instrumental in the lives of families. So if you're new, but if you're not new too, Family Base and Peace Up is where UCAP gets referrals from County Social Services for family-based services. Those referrals are based around child protection reports or child protection cases. They've been identified as needing guidance in the home to either reunify families or retain the family unit as a whole in a safe environment. That's where the Family Base comes in. With the Parent Support Outreach Program, it's a voluntary program that families can commit to. Some of those referrals come from the county, some come from other community partners, but at the end, it always ties back into the county. So the county always gets looped back through with these dollars. And what happens with that is UCAP staff go into the homes of individuals or families. Could be a dual parent household, could be singles, could be moms, could be dads. It doesn't matter what the dynamics look like, but they're kiddos that are in need and parents that are in need of supports. And so some of the things that we can work on is nutrition and organization, parenting, truancy, neglect, just different things that they're needing help with, saying, I need to be able to parent better and more confidently, and what does that look like? County social workers are heavily involved in these cases. They let the UCAP staff know what's the county expectations, what does the county expect to see for reunification, or again, keeping that family unit together. And then we also, because we believe, and I think all of us think that and know that, if we have some buy-in to the plan, we're more apt to support it and really work that plan. And so we also want to hear from the families, what are you feeling that you're needing help with? What would you identify as goals? And so UCAP staff work on both the county expectations and also some buy-in from the parent at that same time. We've been doing this we were just talking, records go back to 1999, but I'm thinking it's more 1996-ish, 97, because we have a staff, Shelley Sersinger, she's been doing this with UCAP for 28 years under contract. Leanne Staffenecker has been doing this for 19 years as well. And then one thing that we've really learned in the past few years, and I guess we've known it longer than that, but really been intentional, is services in first language. And we know that regardless of how good anybody is, things get lost in translation. Words for words don't necessarily always translate. And also the cultural dynamics and understanding changes the trust and the relationship that you can build with families, especially when we're talking about such real sensitive information. And so UCAP has been really fortunate to hire staff in multiple languages. We have staff that speak Somali and Karen and Spanish that all provide support for families needing these services in their first language, which is just a real blessing and kind of unheard of. A lot of the times, we did just hire a new full-time staff person who's Spanish English speaking. She comes with over 20 years of client services, domestic violence services, trauma training, and of course being Spanish. So we're really, really happy. She's just starting her third week. So kind of drinking from a fire hose, but I think she's just going to be a fantastic addition, and the knowledge that she'll bring. And I think that's the other thing I want to touch on is with staffing, is that the training that they have, again, in the trauma and the ACEs and the children's mental health and chemical dependency, and just the wraparound coordination that it takes in their training to say, we aren't the sole people that can do all of this well. We need to tap into other places, right? The schools, Impact 4 and Woodland Centers, and who else needs to be a part of the success of this family. So staff do a really great job in that as well. Currently, staff have caseloads of anywhere from 12 to 18, which is a very heavy load. 18 with this is very heavy. And so we want to look at caseloads and making sure that we can impact at the same level. And if we need to increase and higher staffing, then we do so. And so we'll look at that as well. Lastly, I'll talk about how we connect monthly in person with all the social workers that are referring, and staff and the social workers connect literally on a daily, weekly basis to make sure that they're following plan.
Okay.
Good.
And,
Questions?
and I think we will just segue then right into what Caroline is here for today to.
Yeah, well, yeah, you have questions?
Yes, go ahead
Okay.
and stay up there in case
Okay,
we
I'll
have
stay,
any
okay.
questions.
All right, good morning. I'm Caroline Kahn. I have the opportunity to serve as the Health and Human Services Director for Candy, Ojai County. Thank you for the great overview, Heather, about why we choose to partner with UCAP in so many different ways. So everything she shared prior to talking about the program that we're discussing today are other ways that they impact the families within the programming. So at the end of 2024, or during the last quarter, we had some really intentional conversations with UCAP partners in relation to our family support services and how we would like to continue to move that relationship forward, what we needed from our staff and from our supervisors to best support our families, as well as to how do we start equipping ourselves for the future. There's this little thing called MAFPA that's been going around in the conversation. So we've been having intentional conversations with our partners and really pushing that cultural appropriate care forward and asked. So you may notice that this conversation is coming to go effective January 1st through this year, and I'm here on February 4th talking about this because we needed some time to see, could we hire somebody first language? And then if we can we grow that? So we can start to provide more of that culturally appropriate care now because it is the right thing to do. So that's why I come before you today requesting the ability to move our contract forward with United Community Action Partnership for our family-based and PSOP services. This is an increase in the services as before, but not an increase to our overall family-based programming within our agency. So we will be looking to kind of grow that ability to allow for increased support with our families, as well as growing that first language service. So my request to you today is to approve our contract, allowing for the growth of this program.
All right, and at this time, are there any questions for either Caroline or for Heather? Corky?
Well, I'll have questions after the motion, I suppose. And Mr. Chair, I so move that we accept this contract for, with him for 2025.
There's a motion to approve the contract. Is there a second?
I'll second that, Mr. Chair.
Thank you. Any discussion, questions?
Yeah,
Corky, go
you
ahead.
mentioned there was an increase, like how much was the increase and so forth?
Yep, so we looked at our overall in-home support dollars and how we're supporting families at home, and this would just kind of reallocate to allow for a greater expansion of families in an economical fashion. So the increase would go from about, and can I just use round numbers for conversation, about that 125.5 to a 192.5, so about a $67,000 increase, but overall, the budget that we typically spend on our in-home services last year in 2024 was about $376,000, and this year, once our contracts are moved forward, we'll be looking at about $318. So we are actually finding an economical adjustment with this reallocation of how we're looking at structuring our in-home services, not only for the best use of our staff today and our clients today, but how are we going to continue to grow and leverage as we move forward with the legislation requirements in front of us.
Very good. If I understand you correctly, then our budget does cover this. And it's
Yes,
fine.
yes, this is within our budget and actually a cost savings even so. Yep.
Thank you.
All right, any other questions for either Caroline or Heather? Roger?
Thank you. I don't quite understand if we're increasing the budget, where did the savings come from? Do we taking some work from our staff?
No, so within our contracts, we're just kind of reallocating our contracts moving forward as to how we sat with our staff and said, okay, well, how are we serving our families best? And can we consolidate our contracts to do that moving forward? So we'll be looking at, now that we are knowing that we can move forward with this, looking at our next contract to say, okay, and we've had discussions with our other partners in relation to the work, and that we may have a change in our contracted relationships for this year. Yep.
So we had funds that weren't being used, is that what?
They were just being used elsewhere. So it's the same amount of dollars. It's just with our various partnerships and how we serve families in their home. We typically have partnered with 2 agencies, and UCAP in allowing us to, again, moving forward with that first language, how can we continue to leverage our ability to serve families? Now that we know that we're able to move forward with this growth, then we'll look at changing the other contract to a more streamlined approach.
So these have always been budgeted dollars?
Always been
It's
budgeted
just-
dollars, yep.
You're
and-
just taking from one other place and adding it over here and subtracting it from there?
Yep, and very full conversations with all of our partners at the table with these conversations, and really staff-driven. Like, we went back to the staff and said, you know, where are we utilizing, how are we best serving our families, and how can we best do that moving forward, and taking their input as we make decisions moving into this next year.
Mr. Chair?
Yes.
Yeah, thank you, Mr. Chair. Just so I'm clear on this again.
Yeah.
So then, these other agencies will be cutting their budget.
Their contracts will adjust in reflection. So our families are still gonna get the same, if not more, support with this adjustment. So,
I'm talking about the dollars.
Yeah, the dollar.
They'll get less dollars versus, and it goes to here. Gotcha. They're aware of it.
just in full transparency on how that works, and
Okay.
in full discussion. So all partners are aware of these conversations.
All right. Does everybody have the information they need, or is there anything else that you have questions? If not, then we have a motion and a second on the floor to approve the 2025 Family-Based Services Contract with UCAP. All those in favor say aye.
Aye.
All opposed? Motion carries. Thank you so much.
Thank
And by
you,
the way, it has been just an amazing thing to see that shelter facility come up. And just really excited for that. I remember when that conversation first started happening. So that was fun. Heather, thank you so much.
Yeah, thanks, guys.
Caroline, you have the next order of business as well.
Yes, I do, and I am going to invite our two economic assistance supervisors to join me and share a little bit more about this story. Do you need me to reintroduce myself?
And this is the eligibility worker early hire presentation.
Correct. So just if I could have one moment to reorganize my papers here. This morning, I'm gonna allow them to introduce themselves before we get going.
So I'm Carrie Sharp. I am one of the economic supervisors.
Dana Wenish, a financial assistant supervisor.
All right, as you guys had previously met them at our work session in 2024 related to this issue, this morning we come before you to really talk about the ways that we as a community need to address these critical workforce needs within our eligibility team, and specifically discussing an early secession project. So I'd like to discuss, sorry, I think that we have, do you happen to have that? It doesn't look like it's on the screen here. Are you able to pull it up if you want me?
Who has it?
I mean, I could really go through this without that too, but, okay.
And we have this
Yeah,
in
you
the
have it too.
packet.
So,
This is
you know, we're just gonna
uh,
talk a little bit about our current landscape. Again, we gave you a full picture of where we were at in 2024, but I wanted to provide a little bit more of a landscape snapshot today. So as of today, as we talked about at our work session, we continue to see a rising application volume. We've seen a significant increase in applications that has simply outpaced our staff capacity. I asked the team to pull together some numbers. So high level in staffing numbers in 2019, and really to try to show you pre-COVID, after COVID, a lens on that. We had a combined eligibility team of 22 staff, and today we have a combined eligibility team of 25. In our MNsure and our METs, on an average, in 2019, our monthly documents that we facilitated with that team of 22 was 322 documents in that area. In 2024, our average monthly MNsure and METs documents that we receive is 1,236. So that's a 30% increase in just simply documents that we facilitate on a daily basis. Our medical assistants and other financial support documents in 2019 from our MA, our medical assistants, and our Maxis documents that we created and worked was 2,119, and today that averages 6,018 per month. So that's a 35% increase of documents simply facilitated. It's really difficult to just give you an application snapshot because each application requires various amounts of documents and facilitation and processing within that. I want to talk about our backlog a little bit and the persistent delays in the critical coverage for our community and our constituents. I'm going to tell you something that's going to feel very transparent and very alarming because it is to me, but we're simply at a time where we may eclipse ourselves in our application to renewal timeline. Right now, we're still facilitating and getting through a few applications from March of 2024. And that's not unique to Candy-Ojai County. That's very much happening throughout our community. But I want to allow Dana and Carrie to provide you a little bit of context because when I see that, I'm like, why are we not done? But I need you to understand what's coming in on a daily basis and the lives that we're touching that keep things fluid. So I'm
And
going to.
Caroline, before they come up, This is in relation to the green screen / Oregon Trail type software systems that the state has not updated in literally decades.
Yep, that is a factor.
That's a
And I
factor.
wish that was our sole answer, but it's simply not at this time.
Right.
It's a very complex scenario. If we had a perfect programming system, I still don't feel that we would be able to meet the simple, like the capacity that is coming into the door today. So I would just like an opportunity to just have them put a few stories behind the impacts that this delay is having on our community. Again, I don't want this to be viewed as our staff aren't doing their job, because they are doing everything and then some, and crying on a daily basis with outcries of how do we do this differently? How do we do this better? What could we do to try to facilitate this? And I'm really proud of the work and the efforts that they put in to address this issue, but it's much larger than what we're able to do just in Candy-Ojai County. So now we need to step back and say, what can we do? So I'm just gonna let them share a few stories, if that's okay, as we continue to.
Yeah.
Yeah.
Yeah, if I could just, it's kind of a follow-up on that question.
Okay, go ahead.
This is also part of the COVID thing and the
Yep, the
unwinding, we
Yeah.
call it.
Yeah.
And we're still in the process of that, and
As much
it's
as
getting
we'd like to
bigger.
be
Yes.
unwound, we're still a
Still
little
get-
wound.
we're still tangled
You
up.
know,
Yes.
and so what, you're a little ahead of me in my financial piece, so we'll talk
Okay,
about that.
no, I'm sorry
But yes,
about that.
this is just a really complex, complicated web that the state of our county and the state in general have found themselves in. So if it's okay, as we talk about our broad implications, I do think it's important that we actually put some stories, and we're just gonna do some general weaving of probably some different things, so it's not related to one individual, so I'll allow them a space.
Roger.
Thank you, Mr. Chair. Geraldine,
Yes.
similar question to what Mr. Berg asked about the unwinding process. How long will this unwinding process take? And if it's an unwinding, suggest that it's somewhat temporary, because once you get it unwound, we should return to normal applications. Is that, am I understanding that correctly?
Commissioner, in theory, yes. I think that is the best hope, and that's how I would look at this too. Unfortunately, I don't think that the systems and structures and processes and changes that are in play at this point are allowing us to be successful in that endeavor. Not necessarily Candy-Ojai County, but as a state as a whole, as all counties. Every county wants to be completely done with this, but every county is still working towards this. Unfortunately, if you go to our counterparts and our partners at the state, they feel that we've passed this yet, but there are still implications behind that are not done. And we're living them every day as to how do we, as we talked at the work session, I believe at that time, we had the iteration of the 42nd update of one of the policy manuals. So when they're changing it on a weekly basis and our staff are trying to implement these new changes with little to no guidance, that delays our process to unwind and become fully successful in this. Our best hope is that this will be a strategy to help us get to the point where we're not eclipsing ourselves and and what I mean by that is this application was March, and we're almost in March, so that becomes a renewal then. So it's a process of an application and a renewal. And that's a scary place to be for me, because that's not what we want to be doing. And that's not, again, at a fault to the work and effort and passion put in by the team every day. It's simply the structure and infrastructure we've afforded them. So that's why seeing what's also on our horizon, as we cut to the chase of this, is an early succession plan. We've had conversations with our team, and we understand that some individuals are looking at retirement over the next 2 years or shorter. And knowing that, and knowing it takes 2 years to get competent and confident in this work, again, when you're changing it on a weekly basis or a bi-weekly basis at a minimum, we need to be ready and proactive and see, okay, if we can early hire an early succession plan for these individuals that we understand will be, that have indicated to us, do we have it in writing? No, but we've had some, good conversations with our team members regarding this. How can we control what we can control and start to equip ourselves, and in the meantime, maximize our opportunity to address this critical need.
And Roger, you have a follow-up?
Yes, thank
Yeah.
you, Mr. Chair. In this unwinding process, does any of it have to do with federal dollars that have come through to the state and then to the county?
Yes, there is federal dollars intertwined, so I recognize that, and I even asked Kelsey, and I'm gonna, Administrator Baker, I said, is this the right time? And quite honestly, I'm grateful for her response of the work still needs to get done, and we still need to put our best effort forward. So what I can tell you is that the funds that I'm asking and discussing today are funds that we've already received. So they're not funds that we are a vulnerability of saying that bill's not going to get paid, because they're funds that we already have and waiting to be deployed. So that we received some additional funds from the state to address this unwinding. And prior to my coming to Candy, Ojai County, there was a plan in place. And today my proposal is to adjust that pivot that plan to meet this need differently.
I have Corky first.
Okay. Thank you, Mr. Chair. My comments and questions are kind of a follow-up of that,
Yeah.
or kind of overlapping Commissioner Emdek's questions too. Is looking down the road, I think we're all well aware on the federal level that there's a good possibility there could be even more cuts. And these cuts will trickle down to the state, and the state's gonna have to make some decisions coming to us, and that's what you're saying. So the unwinding, we're unwinding from the stuff of COVID, but we may continue to have even a major unwind if we do any of these major cuts on the federal level. So this is one more reason that I think we need to support this at this point, even though I do not support hiring new staff at this point in time with all the chaos, let's say, on the other legislative levels that we know about.
Yeah, and I hear you, and I appreciate that viewpoint. It's simply, by not addressing this, we will address it in a different way with other critical needs.
Going back to the federal funds, have they been promised or delivered?
My understanding is delivered. That's why I have my fiscal
You're in the
years
bank?
back up. Delivered in our account today.
There's a difference.
There is a difference, yep, and I recognize that.
If I may, I think one of the concerns too, and why I said that comment to Caroline, is because we're already a little bit on the fence with the state, where we're at with our renewals. I mean, we are behind. We're a large county. You can pull the list of counties. These two staff know more, they just educate me on it. We are at a percentage where we're at that could be hindering possible future funding from the state. And so why I say the work still has to get done is because we have the federal money now. We have the state money reimbursement because we haven't tipped under that line yet. But if we don't do something now, we will tip under that line, which will affect our future funding from the state. We can't predict what the federal government is gonna do on that part of funding, but we need to do our part and make sure we can stay above that line so that we can get the same amount of funding that we're currently getting from the state. If we tip below that line, they're gonna say, okay, you're not getting your work done. Here's another slap on the wrist. You know, they put us on performance improvement plan, different things like that. We're on one. I mean, I think that's really the name of the game. We have to stay above this line so that we can get the funding.
And we're not the only county.
Absolutely, we are not the only county.
Yeah.
But why I say because of our size is because we're this regional hub and we have a lot of the individuals that take these services. And so I wanna make sure that we are not falling below that line to provide adequate services to the residents of Kansas County, and not only provide the resources and tools for the staff to be able to get that work done.
Well, to that end, let's hear from staff now, and then if there are any other questions, we'll handle those at the end.
Yeah, so.
Am I allowed to address the one question about when the unwind is undone, that there will be less work? So, the host,
And just for
so,
the record, just introduce yourself.
sorry,
and
Dana Wenish, Financial Assistant Supervisor. We're seeing an increase of applications, so we may be in an unwind process, but those primarily will be renewals and documents, changes from past cases. We are still receiving a large increase of applications, which tells me going forward, I really don't see that that's going to decline. As well as insurance costs through employers is going up quite a bit. You guys know this, you do our contracts. And one of the things that we get applications for is clients that can get reimbursed for their premiums. So instead of just being on MA, they can go onto their employer's plan and we help pay that premium for them depending on income, number of kids, there's a lot of factors. But as those insurance costs through employers rise, I do anticipate that we will not be losing any kind of work. So that is just my comment on that, sorry, as I was thinking it through. In the last couple of weeks, we have had to make some very, very difficult decisions down in our area. Excuse me. I just want to let you guys know some of the ones that we've had to decide that I really don't think, it hurts my heart and it hurts our workers' hearts. We have multiple clients on a priority list right now. We have 75 applications currently marked as a priority. Our oldest priority application is from September 5th of 2024. So multiple clients with transplant needs, we're getting calls weekly. Can you rush this through? Can you rush this through? They're on a donor list. We really need, his MA approved. Then the same day you're getting a phone call, well, we have somebody that's in ICU at Rice because they've been insulin rationing. We need them to have their MA open so that we can get them treated and get them their supplies so they can go home. A call from a distraught mother with a child that has high behavioral needs. Because we haven't been able to process that application, they're not getting medications or treatment so this child can stay in school and move forward with improving. High-risk pregnancies needing care. We had one recently that was an ectopic pregnancy. It was not caught because we couldn't get the MA open fast enough for them to catch that, requiring emergency surgery. And one last thing is a client needing cancer screenings, but CentraCare won't see them until their MA is open. That is probably one of the newest ones, so it's gonna be a while before we get to their application, even on our priority list. So just to stress, these are decisions that, they are life and death decisions that without staff and properly processing these timely, those are the kinds of decisions that we're having to make down there every single day.
So again, I'm Carrie Sharp. I am the other financial assistant supervisor. Kind of to reiterate what Caroline had said about our applications, we also have 511 non-priority applications that we're struggling to get through as well. The oldest one from that is March 1st of 24. That actually does create a double application process when we do it because they are automatically entering those applications, letting it interface into the billing system, closing it to do a renewal because those are way past the 90-day window for the state to generate the renewal. So all of the applications we're processing right now that are old are actually done at least twice, sometimes 3 times depending on different circumstances. On average, the same workers are receiving up to 60 or more phone calls a day regarding applications or changes that we've received, pregnancy notifications, things like that. And they're seeing 40 or more walk-ins, so those workers aren't working in the system, actually entering these applications. They're the ones that are client-facing, and we usually have 2 people doing each of those, one doing walk-ins, one doing phones every single day. Caroline went over the numbers, and I think it's important to just really understand the difference the pre-COVID numbers and the current numbers are. We basically essentially have the same amount of people working. And during this whole last year, we weren't fully staffed at all times. There was about a 4-month period, we only had 3 people working on the MNsure system because we were down staff. So even though those numbers and those documents were getting received, we're nowhere near touching those. We have thousands of documents waiting for us to be processed, and that affects our clients' lives every single day.
Thank you.
Did you want to?
Any specific
Are there-
questions for that?
Oh, yeah, on yours, answer questions.
Oh, yep, did you have questions? I'm sorry.
Are there any questions?
All right, then we're gonna move it.
Commissioner.
Thank you, Mr. Chair. Just want to make a comment that this is a very good presentation, excellent conversation, discussion that we're having. I think we covered a lot of ground on this, and understanding was taking place.
Thank you. I think it's important, as much as it's hard to hear these stories, it's important to honor the fact that this is literally the conversations that our team has on a daily basis. And they're so influential in the way that just our community is able to thrive and the lives of our constituents here in Candy, Ojai County. So again, I'd like to reiterate, we got a little ahead of ourselves earlier in our conversation, but our proposed solution is to early secession plan for the three that have indicated a retirement. I can't promise you at that time. I won't come and say, hey, could we have a little more time? But for today, that is my request, is to plan for an early retirement strategy, succession planning to allow for seamless onboarding and further training and maximize our opportunity to have more hands and hearts touching these programs in that dual timeframe. Again, I think we've talked a lot about how our constituent health and this strategy will impact our community and help us have a greater shovel moving forward. So when we get down to numbers, currently within those unwind dollars in the bank, we have about $233,069.65 if we want to get exact on an average levy cost. So this will help offset that levy cost. Each hour that we're working, there is a portion of state and federal that come into that we receive reimbursement for. But so I'm going to talk to you just about the levy impact and how we're going to utilize these dollars on the levy portion. On average, it's about $15,405 per month to have. So our original strategy, I got ahead of myself, was to have an overhire of one. So it's important that as I propose a strategy that we don't lose sight of that one and just say, hey, we're going to slide that onto the levy and not discuss that. So the numbers I'm talking to you about will include 4 because 1 already exists. So the average levy cost is about $15,500 if we're going to do round numbers. So that means that we have approximately 15 months of the 4 that will be completely covered by the dollars we already have in reserves at the bank to do this project. What happens after that 15? Well, natural changes happen throughout 15 months of working within any workforce, especially high demand jobs. And quite frankly, it is a high demand job with a lot of moral complications to it that add to that. So I don't want to lose sight of the work that our team does on a daily basis. So I feel confident that proposing this to you is an economical, a strategic decision, and also best honors the staff and the community as it works. So the request would be to early hire 3 FTEs at this time in planning for the 3 that we have been told are looking at a 2-year or less, likely 18 months or less until their retirement.
Corky.
Mr. Chair. Thank you, Mr. Chair. I'm a little confused.
Yeah.
You're requesting for 3 slots or 4 slots?
Well, 1
Position.
exists. You guys had approved prior to me coming to Candy, Ojai County, the utilization of 1, and then that would have just covered it longer, right? So those dollars have already been.
I got you now.
Yeah,
Okay, thank you.
So this is for 3 additional.
3 additional.
Yep, and by the way, thank you for framing this in terms of the impacts on real people in all of this. This isn't a theoretical exercise by any stretch of the imagination. Roger.
Thank you, Mr. Chair. So, you described the impact on the levy with the money that we have in the bank and then what we need to, does that carry through into year 2 and year 3, or don't we know that yet?
So at that point, we would look at either not rehiring or coming back to say, can we rehire this as that retirement happens? So if I go downstairs today and have a retirement notice on my desk, we'll have to have a conversation. But right now, it would be that ability to have those 3 FTEs for that 15 months and then have those discussions as we move forward. So it would be 15 months until any of this would have a touch to the levy.
Okay, thank you.
And that would be, the 15 months would be the decision that we would discuss and bring to board if it goes into the budget for how many FTEs they're asking for. So this doesn't go into year 3, year
Yeah.
4.
Without-
We're gonna re-look at that to see if those FTEs are still enough or we don't need them anymore if we're caught up. So that will be relooked at, reevaluated, probably throughout this process, to be honest. And I will say, just to interject on one comment, when I started here in February of '23, I remember the previous director coming to the board talking about an unwinding. And then this has always been a discussion within these units, and we have tried everything. I will say everything. We have tried every option that we possibly can without having to increase the staff. That has been my number one thing that I kept telling them, even when Caroline was brand new. Like, I'm not adding staff, figure this out, come with another option. They'd come with another option, I'd approve it. It wasn't, we were having issues, and so this is something I will say, kudos to the staff, they've held this out. Dana and Carrie have put up with my no's for a while. And they've been very strategic and thoughtful on this. This isn't something that we just thought of in the last month. This has been something the three of them and I have been talking about for a few months. If this is something that we could do, and how would we ask, and how would we present the board with it? It was talked about that at the Health and Human Services Committee meetings. And so it's been really vetted, and I hope that this is the final answer and that we can get over this iceberg a little bit. But I think the staff are really holding in there and trying every other option.
Dan?
Well, I just want to say, from the work session and from conversation that I hear, you know, I think you guys have, like Kelsey said, have worked very hard at trying to make this work. And for that reason, I would move that we hire the 3 FTEs on staff's request.
We have a motion to approve the request of staff for the new hires. Is there a second?
I'll second that, Mr. Chair.
Thank you, Dwayne. Discussion. Roger?
Thank you, thank you, Mr. Chair. And thank you guys for the presentation, because I came here today maybe a little prepared to challenge and push back a little bit on new positions. We really face some potential challenging times here that we have to, we can't have our head in the sand when it comes to this. I have a note in front of me from at one of our futures meetings. We had a presentation from David Huff, who was the administrator of Hennepin County, in the Twin Cities, of course. And he gave a very good report, which is part of an annual report about the number of positions that our county has, the number of new positions, the estimated retirements in a couple of years. It's just the amount of turnover in different voluntary retirements, the number of postings, and all of that information would be really, really helpful to us as a board as we look forward as to how do we face potential new positions, necessary or perceived necessary. Then you add on top of that the threat to federal funding. I know we got a rescinding order about a week ago from a general cutoff of federal funds, but Candioi County is still in the crosshairs as a result of being arbitrarily and inaccurately labeled as a sanctuary county. So we are still in the crosshairs on that one regarding federal funding, which is a threat. And some of the funds, a lot of the funds that we have, if that federal funding is cut off, there simply shouldn't be any work to do because those programs are no longer funded. So we're gonna have to have a hard no on some of the places. So that's a challenge. And then probably as big a challenge as anything to our levy and our taxpayers is the governor's proposed budget. And even if half of that proposed budget comes through, we could be looking at a 4 to 5% levy increase just on cost shifts from the state of Minnesota. Hopefully, if the legislature ever does convene, they will push back on that proposed budget because it's gonna be a direct shift to counties. Some counties estimate, if it all goes through, as high as 9.5%, and that isn't even counting MAPFA. So it's an amazing caution that we should have regarding what we as commissioners face going forward in terms of our levy and our taxpayers' dollars.
I'm trying to.
I'm not asking for a
No,
response.
No,
It's
no,
just-
but I wanna say I hear you, and those are conversations that we have on a daily basis. I had a conversation with, our fiscal supervisor Carol yesterday, because I said, I need to tease out exactly what is our dependency on federal funding. So if federal funding decided tomorrow that it is not paying for an additional way of how they support any of our staff, I now am feeling fairly confident in it's not as big as I thought it was. It's approximately, she hates my hip math, somewhere between 20 and 25% for a year, which is, but again, I was thinking, prepared for it to be a much larger number than that. And when I look at our budget and I look at the way that we are stewarding the dollars and the way that we came out last year and we came out much better than expected. And I'm really proud of the staff and the team and for the work that they do to shepherd these dollars that we receive from our neighbors to do work on behalf of our neighbors. I will tell you that if we don't do this work, we're going to be adding to that levy increase in very different ways at a much more expensive way. Because if we don't meet the critical health needs or the mental health needs of our neighbors because they're not able to get their MA processed, and I hear that if MA isn't funded at all, that doesn't exist, but there will just be some other way in which we're required statutorily to meet that need. So we're gonna need these hands on deck, and if we don't start to get out of this hole, we're gonna find ourselves deeper. So we're balancing these strategic decisions, and what if we, about 6 months since that work session? Like, the work session, their hope was that we'd come out with more staff from that. And we went back to the drawing board, and we tried a new strategy, and we tried a pivot in a different way, and we tried all these other solutions, so we didn't have to do this, but we simply cannot not put our best effort forward and make this request on behalf of the staff. And I hear you. I have those same concerns and go through that frequently, because with the governor's proposed budget and with other things we are looking at. So how do I keep you all informed and looking at what are we scheduling in for work sessions that we maybe weren't planning to schedule in, because you need to have all the information available. So I guess my response is I hear you and I have those same concerns, but I also have to weigh the needs of the neighbors, same as you are too. And we're just coming at it together.
Thank you, Mr. Chair, and you don't need to convince me again, because I said I was there to push back. I'm not going to push back, I'm going to support this.
Yeah.
I appreciate that.
As our taxpayers and as my colleagues sit up here on the dais, it's something, and you as staff and administrators, something that we may clearly have to face in the upcoming months and years.
I hear you. And I appreciate being a part of a county that can have these robust conversations and really look at it from all lenses. So I appreciate that.
Corky.
I just want to pile on this conversation as well, because this is maybe a good time to have this discussion. This is a really good discussion, and Commissioner Endek, your statements are just really right on, I feel. I hear from citizens in our community about the dollars and everything, and all of a sudden, we hear what's happening on the federal level too. We have to be really, really careful and watching every penny. Not that we don't. I'm not saying we're blowing money here at all.
No.
Just that we're gonna have to just double check everything even more so now as we go forward, and people are concerned, you know, what we spend our taxes on, and we see on a federal level, people want to eliminate government, you know, and that's not a lie, you know, this is where we're at, and we gotta be prepared for that. I remember years ago, when one commissioner was concerned in the board, this person was a rural commissioner, and the price of eggs went up 25 cents. Yes, and they made some decisions about increases because of that. You know, we have to be, the buck stops really with the board. So we're gonna watch things even more so and be more conscious, I feel.
Anyone else? All right, anything further for us on this? Then we will move the question. All those in favor of the staff recommendation signify by saying aye.
Aye.
All opposed? Motion carries. Thank you.
I just want to extend my appreciation on behalf of all the staff downstairs watching.
And our
Good.
appreciation to
Thank
you and all of that, all of those staff. It is incredible work that you do under a lot of really severe constraints. And thank you all for that work. Do we need a break or anything?
Before we take a break, Mr. Chair, I would ask for a little indulgence on something I was gonna report on the report outs, but I see that Carol Tollefson is here, so, if I could do it now instead of then.
Sure.
So I received a letter from Commissioner Harpsted
You might as well come up.
recently, yeah, please come on up, on the 2023 audit, so it was really late. And I'm thinking, why am I receiving this? And it's, oh, I saw the date and I saw that. And I'm gonna read the letter. It says, Dear Commissioner Imdick, she said, it's my pleasure to commend you and your staff for perfect performance in meeting the Department of Human Services financial reporting requirements for calendar year 2023. All key quarterly fiscal reports for programs and your programs your county participates in were submitted to our Financial Operations Division on or before the report deadlines in perfect order. This effort required submission of 32 major reports covering the 4 calendar quarters of 2023. These reports are, and they go on to list them. If your county participates in a local collaborative, submission of this report may require the collection of multiple local partner reports for consolidation to submission to DHS. I know this accomplishment requires planning and efficient operation and teamwork within your county human services department. The result is timely for your county and the compliance with federal reporting for us at the state. Please congratulate your management and staff on this superb effort. Sincerely, Jody Harpsted, Commissioner. So, congratulations.
Consider this the congratulations.
Thank you, I appreciate it. Thank you.
So, all right. Does anyone need a break, or can we bring Corey up first and then take the break?
Let's do Corey.
Let's do Corey first. All right, let's do that. Oops, and I am on the wrong page. Hang on just a second. Corey Smith, go ahead.
Good morning, Mr. Chair, members of the board. Corey Smith, the director out of Glacial Lake Sanitary Sewer and Water District. I'm here before you today for the New London Water Tower Restoration Project, the project acceptance, and the final payment. For this project, we received 7 bids on March 12th. Slack Painting LLC of Brandon, Minnesota was the low bid at $436,650. The project consisted of complete sandblasting and reconditioning of the interior wet and the entire exterior, partial removal and spot repair of the interior dry, full curtain containment, updated SCADA equipment, and installation of a mixer. The work itself began on May 27th and was substantially completed on August 25th. During this project, we had to take the tower itself offline, and it was offline from June 14th to July 26th. And during this time, we had to rely on our high service pumps to provide drinking water and pressure to the residents of New London. The project itself came in at $21,866 under the original contract price, which brought the cost down to $414,784. On January 27th, the commission recommended forwarding this to the county board for consideration. And with that, it is commission's recommendation to accept the project and make final payment to Slack Painting LLC.
Mr. Chair, I would move on staff recommendation.
We have a motion to approve accept the project and make the final payment. Is there a second?
I'll second that, Mr. Chair.
Thank you. A motion and a second. Discussion. Hearing none, all those in, go ahead.
Just a comment. This was a major project, very major. And a lot of pieces put together on this, and did an excellent job.
Thank you. And if I may add to that, just a reminder that we are looking at going at a federal CDS grant for our other 2 water towers that we have. I believe we'll be submitting that application next month and hopefully looking for funding and completing the other 2 towers in 2026. So.
Very good. Any other questions? All those in favor, say aye.
Aye.
All opposed? Motion carries. Corey, thank you so much.
Thank you.
We will take a 10-minute recess.
Like those pictures that they had. That is amazing.
IT, are you ready?
Ready. Make sure he sees it, you flaunt it in front of him. All right, the Candido High County Board of Commissioners are back from recess. At this time, we'll ask Mel Odens, our Public Works Director, to come up and introduce 3 separate items to us.
Mr. Chair, members of the board, I'm Mel Odens, Candido County Public Works Director. The first item, I do have 3 items consecutive. The first one I had is our maintenance striping that we do. We do about 150 to 160 miles every year. And it's a latex paint. And then the other thing we do is all the incorporated cities except the state aid city, which would be the city of Wilmer. But we do all of our maintenance striping on a third of the county and then all our incorporated small cities. So with that being said, bids were opened in March of last year. They completed the project last summer. What you have before you is the 5% final retainage of $6,736.39. So it's my recommendation to accept the project, issue the payment for the final retainment, and make final payment to Camco Incorporated out of Dassel, Minnesota.
All right, you've heard the request of staff. Is there a motion to accept the project and make final payment?
Mr. Chair, I will make a motion to accept the project and make final payment to Camco Inc. out of Dassel.
Second.
A motion and a second, and is there any discussion? Hearing none, all in favor say aye.
Aye.
All opposed, motion carries. Next item.
Mr. Chair, the next item is a detour agreement. Oh, wait a minute. That's the next one I have here. The next one actually is final payment for the walking trail on the North Shore Drive, north side of Green Lake. A little over a 4-mile trail. The projects were, the bid were open on July 18 of actually 2023. I wonder if that's not a misspelling, but whatever. The project was built last year, and what it was an overlay of the project and all the ADA improvements. The bids it was completed in October of last year, and maybe you recall if you ever drove the project, when the project was put in, originally we did have some, we run into somewhere when we're milling, what we do is we mill off the top and then we overlay it with a 2-inch mill. We actually were milling through. So we run into a few areas that were a little unexpected, but with all being said, we think the project turned out good. It's a little over 4 mile of a trail improvement for us, and it all meets ADA now. So it's my recommendation to accept the project and authorize final payment of the retainage plus some minor concrete items in the amount of $20,931.15, and accept the project and make final payment to Dunick Incorporated out of Princeburg.
Mr. Chair, I'd move on staff recommendations regarding final payment and accepting the project.
We have a motion to approve. Is there a second?
Go ahead.
I'll second.
Discussion. Mel, just a quick question. I think I'm hearing you say that there were some areas of that initial project that were not built to spec. Is that essentially?
So what we found was when we were milling, we actually milled through into the gravel in a couple areas, so we had to beef it up. So you do see, if you look through all the details in there, we had to beef up a few areas. But honestly, the good part of it is it wasn't failure, prior. We did an overlay, and an overlay is just to give you back your ride and get rid of some cracks. And we were surprised because the path held up very well, but that whole area is gravel anyway. So the subgrade up there is all gravel anyway. So, we feel good about it.
Okay. And Roger?
Just on a side note, even though there's a really nice trail there, a lot of people think they have to drive out on the street.
Yep.
Even though the trail is 20 feet away from it.
But that's good and bad because there's kind of an unwritten maximum speed on trails, 15, 18 miles an hour. And the people that ride road bikes we would prefer them to stay on the road. Because on the trail, you have people walking and actually enjoying themselves versus sweating. And they sometimes get a little bit frustrated when somebody whips right by them. And that is something that actually, I think, might become more prevalent with e-bikes, because people, now the casual people have e-bikes and they ride the trail because it is casual. They're not out there just trying to do their 12-mile lap around the lake. They ride on the trail, and I do know that is something that I do get some complaints on.
Any other questions or comments? All right, we have a motion and a second to accept the project and make the final payment to Donna Gang. All those in favor say aye.
Aye.
All opposed? Motion carries. Thank you. And your final item.
The final item is a detour agreement with MnDOT for using 10 miles of our County Road 3 and 7. This is the third detour agreement we're having with MnDOT this year. 2 of them are in this location, and I don't know if could we pop this up on the screen quick? So maybe could we zoom in a little bit more? All right, that's pretty good. So here's Wilmer up here, and the detour for this is gonna be on this piece of work right here. They're gonna be doing some concrete paving, some guardrail work, some miscellaneous work along here, but you might, and they're gonna be doing that from August through November. You get the door?
You're okay.
August of November through this year, that's when this work's gonna be done. But you might remember that when we did a detour agreement earlier this year, they're going to be doing a turn lane on 1 and 23 and a turn lane over here on 3 and 71 by Demographics. That work's gonna be done in April through July of this year. So we're gonna have detours going on. The detour for this one is here over to Raymond. The detours for these two, which we did at the last meeting, is gonna go down 5, down to 7 for the heavy commercial, and the car traffic would go over to Raymond. So the point of all this is that we've got basically 3 detour agreements in this area. This one is for this one only. And so what the state does is they enter into a detour agreement for maintenance and road life consumed. So for the 10 miles of road that they have earmarked for this work, the state will be paying us about $56,976. And that was for a 90-day project. So it's my recommendation to pass resolution 2025-5 and authorize the county to enter into this detour agreement with MnDOT for this project this summer.
Thank you. You've heard the recommendation of staff. Is there a motion to move on the resolution?
Mr. Chair, I will move to pass resolution 2025-5.
Thank you. There's a motion to move the resolution. Is there a second?
Mr. Chair, I'll second that.
Thank you. Discussion? Hearing none, all in favor say aye.
Aye.
Aye. All opposed? Thank you. All right, and we are back to perfect timing. At this time, we have 8th Judicial District Treatment Court presentation, Tammy Jo Lieberg and John Petron.
That wasn't working earlier, but I will, Melissa will be able to still pull it up on the screens.
Okay. We'll see if it comes up, but if it doesn't. We have it here if it doesn't come up. So, oh.
I have it up.
Okay.
I know that
Yeah, that works just fine for us. Okay, good morning, Tammy Jo Lieber, Director, Community Corrections, and I have with me John Patron from Community Corrections as well. We're going to give the presentation on the 8th Judicial District Treatment Court. John is our drug court probation officer, and he's gonna discuss it with you today, and then I'll be available for any questions, so.
All right, morning.
Yeah.
And just introduce yourself for the record.
John Petron. Yes, I am from treatment court. I'm not even gonna use that. Treatment court is an intensive supervision of high risk and high needs drug clients. Currently, we have 16 people with 4 pending from our county. We also partner with Meeker County, and they currently have 5, and I think they've got 4 pending also. All of our referrals go through Shane Baker, and then they come to the treatment court team. The team is made up of Judge Wenzel, me, Laura Garvey. There's a lawyer for the clients, and we have 2 social workers. The clients are usually in this about at least a year, if not more. They work through stages. On stage 1, they are all in treatment. And then I contact them at least 3 times a week. And then once they get through that stage, then they go to stage 2, where I don't have to contact them as much. It usually goes down to at least once a week. And then there's stage 3, 4, and 5. We have court 3 times a month, twice here and once in Meeker County. Stages 1, 2, and 3 have to be at all court hearings. Stage 4 and 5 have to come at least once a month. We test them 3 times a week. I do weekly home checks with them, sometimes at night and on the weekends. I sometimes call them on the weekend nights to see if they're home, because they do have curfews. The success rate, I don't have those kind of stats. But the clients, once they graduate, then they go back to regular supervision. And that's a step down, and they're usually on for at least another year.
And so, John, if I may, then this is, as you say, really an intensive program, and the clientele are really deep into this addiction. And this is why they need that type of supervision. If we don't have this program, then what happens?
So, drug court is a specific program designed for specific types of people placed on probation. We have multiple types of intensive supervision, right? And so for drug court, they are identified as high-risk, high-needs individuals with this type of need, right? So there's other programs for some people with different types of needs that we might have on a different type of intensive supervision. So it depends on how they're identified as what type of needs they have. But this is one specific program for individuals with this type of need.
Thank you. Any other, is there anything you want to add first before we go to questions? Or
We can go to questions and we can see where we're at unless,
Okay, yes.
Yep.
Tammy, John presented on this at the Community Corrections Advisory Council meeting, and I thought it was interesting information because it's changed a little bit. Maybe you want to talk a little bit about that, how it's changed from DOC, how our county staff are now taking this on, because
Yep.
I think that's important for the board to know.
Yeah, Kaneohe County Community Corrections, just in the last 6 months, have taken drug court back from the Department of Corrections. For the last couple of years, the Department of Corrections had run the drug court, or the probation office for Department of Corrections had been having assigned a probation officer. Due to funding cuts to the Department of Corrections, they have withdrawn in the past year out of the drug court and were no longer providing that service. So as a county, we stepped back in and are now providing the probation officer as part of that. Now, part of the drug court is providing some of the funding for that. So we are receiving some of the drug court funds for John's salary. So the county is able to recoup some of those dollars back, and some of the funds back for that is part of some of the things that we're doing. But the drug court is not funding it entirely, is how it kind of works back. There was a time years ago that Kaneohe was part of the drug court, then Department of Corrections became part of it, and now we're back involved. So that's one of the reasons we're not able to give you real solid statistics right now, but we will be able to give you statistics as we go forward, is because now that we're back involved, we are going to track some of the statistics and how things are working through the program, and the evidence-based practices that we're using, and how they track through not only just drug court, but back into our supervision level and where we're going with our probation.
Thank you. Are there any questions? Corky?
Thank you, Mr. Chair. So, several of us have been to drug court graduations, for example. What you're saying, though, is going to continue kind of like what it was, except we are going to be a bigger part of that.
That's correct. We are still involved with it. We are collaborating with the drug court team, with Shane, with Judge Wenzel. It's just now it's our probation officers with Kaneohe Community Corrections that are involved instead of Department of Corrections.
That's good. All right. Good collaborative effort. Thank you.
Any other questions?
And just to be clear, like we talked about in the last couple of years, even though our probation officers weren't supervising the individuals, we had opened our doors for our cognitive programs and different things. We were always involved to a point with drug court because they didn't have the capacity to have the cognitive programs that we were using. And so we had always been involved to a point in the drug court.
And I suspect that that's an important component to all of this, because when a client is just starting this, they've still got those old ways of thinking, those old patterns, that type of thing. And so it's the cognitive piece to this that assists with them kind of getting their hands around and their mind around the idea that, hey, things can be different. Is that a fair characterization?
Yeah, not only is it a critical component, it's actually a required component as far as evidence-based practices as part of the way drug court is supposed to be run, is to include the cognitive behavioral programming.
And then to my earlier question, if we didn't have this program, what would happen to folks who are just in in the standard probation without the supports,
We might see a
allow them to,
higher level of recidivism and
Yeah.
people more in the jail and higher costs. We know that higher levels of recidivism, higher costs are in jail, more people, more kids in out-of-home placements, more just general costs in the community, more victims in the community. And some of these programs really, it's hard to put a dollar amount because not only are we looking at the cost, the tangible costs of the cost of the jail and the costs of the, what we spend as community dollars, but also the cost to our community in terms of families, what happens when your children, brothers, sisters, neighbors, and people are addicted and what happens to them.
Sure. Corky, go ahead.
Oh, thank you, Mr. Chair.
You were waving at me, right?
Yep, yeah, I didn't want to interrupt you though. I just want to comment, you have really a great team you put together there, and it's been operating quite well. And I want to give a shout out to Judge Wenzel too. He does an excellent job.
John, can you speak to the transformative piece of this for the folks who get through the program? Because we're really, at the end of the day, we're looking at outcomes.
Right.
For these individuals and their families and their loved ones.
Right. Once they graduate, most of them have been sober for months or like, if not years. The average person that we've been graduating has at least 900 days sober. So at that point, a lot of them are really at the point where they've changed so much and they've changed their friends, they change what they do, where they hang out, that they don't even want to go back to that. We do have the ones that relapse again, and we try to catch those as quick as we can so that we can get them back on track again.
And you bring something up with that, then if there is a relapse or something like that, that doesn't necessarily mean the end of the program for them. There's a reset period.
Yes, there is. And we try to use jail as the last possible thing. And if we do have them in jail, Judge Wenzel's thought on it is we want them out as quick as possible into treatment again to keep them going.
Any other questions? Comments? I think this is one of the unsung programs within our county. And the difference that it makes in the lives of people, like Commissioner Berg said, I too have been to a couple of these graduations, and it's really amazing to see. You're looking at people who have literally been transformed through this program. And the community is better for it. Our society is better for it, and certainly the individuals and their families are all better for this as well. So, any last comments, questions? John, Dr. Lieberg, thank you very much for being here today and giving us that brief overview, and hope to make some more of these graduations as we're invited.
Thank you.
Thank you.
Yeah, thank you so much. All right, we're decent on time, so we're at the administrative updates, appointments, calendar, and committee reports. Are there any administrative updates that we need to hear right now? Any appointments? No? All right. Please go ahead.
Two calendar changes. One is for February 25th. It's a Tuesday. Yesterday, we had our space study meeting with our building committee, and we've added some staff to represent each committee, or I'm sorry, each building. And yesterday at the committee, Wold Architects and Engineers was proposing a board work session. And so we were looking at everybody's calendars, and we would like to propose February 25th. It's a Tuesday morning. That afternoon, you would leave for the legislative conference. But we were proposing 9 a.m. We're figuring about an hour and a half, 2 hours tops. So if that works. In person, yep. So Wold would come here, yep. Wold would come here and bring the board up to speed on where we are at with our findings and different things like that. So I would, if that works for everybody, I will schedule that in. The full board, yep. February 25th at 9. Everybody is good?
Anyone have a conflict with that?
Corky, you're?
Good.
Okay. The other one, Caroline, I think just was so in transfer eligibility, forgot to mention that March 4th doesn't work for the work session anymore. We would have a supervisor out, and we would like to present on HCBS waivers, home and community-based waivers, and how that process works. It's kind of a hot topic in the government, state, and federal government right now. And so March 4th doesn't work for them, but March 11th does. That's an off week. That would work for her and the staff. Would that work for you all?
I'm open.
That's Township Association,
Oh, that's right.
election day for county township, or townships. Their annual meetings. What's that?
Their annual meeting's the 31st.
Yeah, but their
Election.
their annual meeting is, each township meets. I mean, it starts at like 3 o'clock, so would we be done by then, or?
Yeah, I would propose like 9 a.m.
Oh, okay.
Yeah, I'm good.
That'll work.
Yep, I'm good.
I am on vacation that week, but I am fine because it's a Health and Human Services work session, and she will lead, her and her team will lead that.
Okay.
But if it works for everybody, we'll schedule that in as well.
That'd be about a 9 a.m.
Yep,
What do we call that one?
the Health and Human Services work session. I'll get these on your calendars.
And then
Yeah, can you send out reminders?
Yep.
Yeah.
But I will say to sit tight on the March 4th date. Don't fill that in too quickly.
Okay.
Mr. Onmak would he's gonna be here presenting on the strategic plan. He's gonna kind of give the lay of the land on what his process will be. More coming from his point of view regarding what was in the proposal. He might need to meet with you individually following that meeting, but I'm connecting with him this afternoon, so I'll keep you all posted on that. And I think those were the calendars and then just a reminder on the next Tuesday for the board operating guidelines procedures work session, that's at 10 a.m. And then, so we'll change that work session for human services on March 4th, and then road and bridge work session for March 18th, that is planned. Austin had sent out a ditch hearing, so that'll be at 1 o'clock, but we might be able to start road and bridge prior to that. It'll just depend on what's on the agenda. So I can I'll hopefully keep you guys moving.
And I did have that question for you regarding road and bridge, how much time that's going to be, because we do have
2 hours.
2 hours, perfect.
Because with the
Yes, and we have
Intergovernmental.
at 3:30. Yes.
And that's here too, right?
Yeah. All right.
Is he scheduled?
Yeah, we're jammed up here the first 3 months of the year especially, so. All right, any other calendar items?
I can mention a little bit, so this has kind of been, I feel like I'm really gonna geek out on this now, but this has been, I've been in county government since 2017, and I've always wanted to do something like this. But I posed it to the department head group, and they were really excited, I mean, they were excited, you guys, it's kind of a fun thing. If I was in high school, I would be really geeking over this. April 4th, it's a Friday, we're gonna have a student government day. I don't request all of you to be in attendance, because I know you guys all have busy schedules, but it would be nice to have at least 2 of you. So if you wanna let me know which 2 of you, if you want more to come. We're really mirroring this from another county. They've had really success in this. We're starting with the Wilmer and New London Spicer school districts. So we'll have a group of kids come from both schools, and we'll do a Q&A with the department head group. We'll maybe tour a dispatch center. County Attorney Shane will help do maybe a mock trial. We're still working on the schedule there, but I'm really excited that we're gonna be able to do something like this, and hopefully it will continue to grow and kind of flourish, and we'll continue to make it our own. But that was the other thing I just wanted to touch on. Here, yep. So the Q&A would be nice to have a commissioner on the panel for questions, and, just talk with students about what county government does.
What time is it?
In the morning, right?
Yeah, I'll send you guys the draft schedule that we have, but I think it's starting around 8:30.
Yeah.
8:30 or 9.
That'd be kind of interesting, but maybe somebody else does.
Yeah, it's a very tentative schedule now, but the school districts were very excited to promote this within both schools. So we sent them a tentative flyer and a schedule, so you'll be more included when we finalize everything.
All right, very good. Thank you for that. And, I'll mention it now before I forget. Tomorrow morning, I'm gonna be sending you out evaluation forms. It is that time of year where Administrator Baker has her annual performance review. I'll be sending those out to you tomorrow, and there will be instructions for completing that form, and we'll want that back within about a week. And then after that, I haven't told you this yet, Dwayne, you and I are gonna review these and compile the results, and we'll bring that back. Then there will be a session in our next board meeting following that, or at our next board meeting. Yeah, okay. So wanted to mention that now before I forget. We are now at committee reports. Commissioner Berg, are you able to?
Yes, I will. I'll be happy to start. Actually, with a 5th week, I did not have as many meetings, and it was very nice to have some extra time, even though I ended up being on the phone a lot and doing some other things, but I didn't have a lot of things scheduled. I did have some things happening though, and I just want to share with you, and one very important thing. Attended open mic with Administrator Baker, and we had a very good conversation. That went really well. I had an EDC board meeting, and I think other people will be reporting on that. So things are moving right along there as far as replacement for Mr. Blackman, and we got more to report on that down the road. The big thing I really would want to share is that at the end of the day, on Friday, I received notice that Prairie Lakes Director, Dr. Holly Booth, submitted her resignation. And I have to say, I'm very sad to see that happen. She's had such a great working relationship and went both ways with the board, and had met many challenges that were outside of the scope that could be prevented. For example, COVID, when she started working, and the budget issues because of COVID, and the placements and the financial issues of the problems of the board because of all that she had to take on. And then we had the fire to deal with. So she's been through a lot, and she got us through a lot, and we have a great team that we have. She submitted her resignation then on the end of the day on Friday, and she gave us a month to find a replacement, and so she'll be with us still until the 31st. And we have very good team, and she's put together and helped a very good team managing the Prairie Lakes program. And I'm assuming going forward, we'll be meeting as a board and to deal with, do we look at doing this full major search or not again, and we will be meeting to finalize how we're going to move forward. But in the past, there's 3 different departments, or there's several different department heads underneath there with the group homes and the secure unit. And we have excellent directors in each one of those. And in the past, somebody stepped up and would be the acting director until we got a replacement. I think we're going to, as a board, I can't speak on behalf of the board at this point, but I'm sure we'll be looking at internal candidates as well as external candidates. So we are planning to move forward with everything planned. Dr. Booth had laid things out really well with the board going forward. So we're in really good position for something like this. We just hate to lose her, but we were lucky to have her this long. She did an excellent job.
All right, thank you.
I had a Soil and Water Conservation District meeting right after our last meeting. Kind of interesting, that was the first one I've attended. Just kind of interesting to see what they're all up to and what, in their new building. That was their first meeting in their new building, so they were pretty excited to show it off. And it's actually kind of amazing. You walk in, it looks like a pole barn from the outside, but you walk in, it's a really nice meeting and office facility that they added on, so kind of impressive. The next night, I met with a group of concerned township people on planning and zoning, just to hear some of their concerns, and they're gonna present something to Kelsey and see where that ends up. And the other thing that I had, which, like Corky said, it's kind of an off week, was just the tourism meeting yesterday. And they have a lot of stuff going on in the county like always. The interesting thing, I was talking to Ralph a little bit on the break, we're still seeing almost 50% of the money spent in Kansas County coming from outstate. So it's kind of amazing that there's still that much people coming into this area to see this area, and I'm guessing the Spicer Fest had a lot to do with that people came in to see the castle and to, be part of that event. But it's fun to see from month to month. I thought maybe it was just Christmas that we had that stuff, but Sioux Falls and Fargo are kind of our big people places that people are coming from, so it's interesting. But that's all I have.
Thank you. Dwayne?
Yeah, so I had 6 meetings in the last couple weeks. C6 Drug Task Force met, Drug Free Coalition. I sat in for Steve Gardner, who was the delegate. I'm the alternate because he had another commitment he had to go to. Had an AS Task Force meeting, Armors, that was last week, and then I had Broadband Committee meeting yesterday, and then Vision 24 or 2040 meeting yesterday as well. And then to keep things short, I basically left my minutes in my mailbox, so if anybody wants to look at it, they can. But I do want to mention Vision 2040. We bumped up the budget to set aside for the 2030 census, and then also for housing. Housing study. Thanks. So the census is gonna, it seems like a long ways away for 2030, but it all of a sudden, ends up being right on your lap. And so part of the plan is to set aside money so that we're more prepared this next time for when it comes up. And the census is very important for a lot of different factors, and I'll just leave it at that. But hopefully we'll be prepared this time a lot better than last time, maybe.
Thank you. Roger?
Thank you, Mr. Chair. So, since our last meeting we had a Prairie Woods Environmental Learning Center meeting. It was the third of 3 strategic planning sessions. And so, we had that. It was actually not the strategic planning, it's part of it, but it was the master plan that is being developed by SRF Consulting. And so we had the presentation on that. I had an EMC Board of Directors meeting on Friday the 24th. On Monday the 27th, I had a CPT meeting in Morris, and I put that information, or I sent it to you like Dwayne did, because I would likely forget some of the stuff that was discussed at that meeting. Then we had the, Glacier Lake Sanitary Sewer and Water District meeting. And then, the space study, board, yesterday, or was it yesterday? Yeah. And then also broadband, and at broadband, Dwayne and Administrator Baker were there. We got some disconcerting news for me in that the BEAD program, federal dollars coming to the state of Minnesota, about $652 million. Largely, Kansas County will not be eligible for those funds because of supposed designation that we have areas that especially in southern Kansas County, that are considered served because they have fixed base wireless options. And so that really creates a challenge for us of how we go forward to fund the final build out of broadband in Kansas County. And that's all I have.
Thank you. Since our last board meeting, and first of all, I want to thank Dwayne for stepping in on the DFC meeting, and also Kelsey and Corky for taking care of old Mike. I was at in St. Paul for the AMC Leadership Essentials board chair training, and a nice session. It was their first crack at this, and I'm sure that there will be some suggestions that come down from this, and something that I'm sure that they'll continue in the future. I found it helpful. And then the second day, we sat in on some of the training that we've all done for, at the same time, they were concurrently holding the Commissioner 101 training for the new commissioners. And so got some refreshers on things like open meeting law and other scintillating topics like that. So was able to take that in. The EDC Joint Powers Board, primarily that was a business as usual sort of meeting, and as Commissioner Berg indicated, we have the process moving along in terms of our executive director search. We've been informed, was it just yesterday, that we had, was it 16 applicants for the position, and there are 10 individuals that have been invited as semifinalists to continue with the additional vetting. And we have a special Joint Powers Board meeting scheduled for the 24th, at which we will select our finalists for that position. We're scheduled to do that anyway. And between now and then, we'll have some video interviews and some assessment worksheets that will have to be taken in our, and I say this in partial jests, in our spare time. So we'll have the three of us on that board, and our city counterparts. We'll have plenty of work to do in that regard. Roger and I had AMC Board of Directors, and also on the 24th. The legislative update that AMC put on basically gave us the state of disarray that state government appears to be operating in at the moment, and that continues to be unfortunate. West Central Industries meeting. I need to open this one up because I don't, oops. No, just open up the date, please. No, it's not doing that for me either. Oh, there we go. Yeah, that wasn't necessary to report on. AMC Leadership Essentials concluded with a virtual meeting then on the last Thursday. Several of us attended a presentation by Spectrum on Friday over at the Wilmer Community Center. They presented a check for to the community center for a mobile computer lab, essentially a project that they're doing, and they had a nice little presentation on splicing the fiber cables, the thin little cables that I couldn't even see. So I'll take their word for it that they were actually splicing cables. But an interesting process there. And then yesterday I was down in, a meeting got moved to Marshall because of township meetings happening in Renville County over in Olivia. But the Supporting Hands Nurse Family Partnership Joint Powers Board met down there yesterday. And our executive director will be going out on a leave. And so Sarah Benson, the Human Services Director down in Renville County, will be stepping in, contracting on a part-time basis to help us with that over the next several months while our director is out on leave. I'm thinking that I had one more thing, but I can't. But it's gone. I can't think of it. So. Is there anything else, Dale?
Well, I just opened an email here. Soil and Water Conservation District is having an open house on April 1st from 10 a.m. to 5 p.m. and that's open to everybody. So I just seen that, so I thought I would mention that. So.
All right. Thank you for that. And is there anything else? If not, then we will adjourn this meeting of the Candy Ohio County Board of Commissioners. Thank you, everybody, and thanks out there, everybody, for watching.